Hi, my name is Mark Lorenz, and I've been a physio for 27 years now. I've developed the ArmLock brace, but I have to give a lot of credit to the development of the brace to a blind physiotherapist named Charlie Kelly here out of Edmonton, Alberta, Canada. What he taught me was that to treat tennis elbow, you don't focus on the elbow, you focus on the muscles on the back of the forearm. So since working with Kelly, I've done a lot of massage therapy to the back of the forearm with success. But being a physio, I've also added something. I've incorporated a stretch. And so that stretch is called the ArmLock manual technique. So for a long time I was stretching patients and I'm holding them in this position. So I'm stretching the finger extensors, which do attach there, one of the wrist extensors, and the muscle that turns the palm up, the supinator. Primarily just these two fingers and part of this one attach here, and it's just the superficial head of the supinator that attaches there, but still we're stretching them all out. And that worked really good on releasing those tissues in there. So the whole idea is we're stretching out the knots within the muscles. Sure, the muscles can get tight with overuse. You're doing a profession for the last 10 years, whether it's dental hygienist, you're squeezing, holding your fingers, or you're typing and you're holding your finger over a mouse over and over and over again. Doesn't matter the occupation. If you're doing the same thing over and over, month after month, over years, those tissues can really build up some really nasty knots. So they've biopsied those tissues, and what they've found is those tissues actually are contractured muscle tissues. Those myofibrils are shortened, the actin-myosin bonds, they're tight, right? So we have to release those bonds, and the best way to do it is to stretch. You can rub them out partially. You can also stick needles in it, which may desensitize it, but you're not really treating it. To treat it, you have to pull those trigger points apart. So there's lots of different kinds of tennis elbow. You can have tennis elbow that comes from your neck. It's not true tennis elbow, it's referred pain from your neck. You can have pain into your elbow from your thoracic region, the nerves up here. The ArmLock brace is really purely for people with trigger points in their muscles, tight tissues. So to be a candidate for the ArmLock brace, you have to have a tight muscle, you have to have palpable nodules in your muscles, and it can't be acute. So your condition should be at least 6 weeks old. If your condition is 6 weeks or younger, you're probably still in the inflammatory state. Stretching muscles in this state will be quite uncomfortable, and the ArmLock would probably just be aggravating. So really you have to have the condition for a long time for the ArmLock brace to work, about 8 weeks or longer. So biggest take-home message is focus on the muscles, those trigger points. The best way to work them out is stretch. The ArmLock brace can do that.